Okay, so we'll get it kicked off. So good afternoon and welcome to today's BreastScreen Breast Cancer Awareness Month webinar brought to you by BreastScreen South Eastern Sydney Illawarra. My name is Faith Shearer and I'm the Site Manager for the Southern Sites within BreastScreen South Eastern Sydney Illawarra. I would like to acknowledge the Bidjigal people who are the traditional custodians on whose lands I am on today, and I acknowledge the traditional custodians of the lands of where you are joining me from today. I pay my respects to elders past, present and those of the future. I would also like to acknowledge and welcome the Aboriginal staff present for today's webinar. This webinar is the fifth in the series of 5 webinars being provided during Breast Cancer Awareness Month. All webinars in the series will be recorded and will be accessible from the BreastScreen South Eastern Sydney Illawarra internet page. Today's webinar is titled Increasing Rates of Breast Screening for Aboriginal Women, Current Ways of Working. This topic is dear to my heart because I have been wanting to make improvements in the way we provide breast screening for women in Aboriginal communities, particularly in the south of the service, which is the team and area I manage. Before I hand over to the presenters, just some housekeeping to go through. We'll hold questions to the end of the presentation. If you'd like to post your questions in the chat, please feel free to do so. Your cameras and microphones are turned off for the webinar. Feel free to use the icon at the top of the screen to post your reactions. We have 3 presenters to present today's webinar. Sharon Brown is a proud Bidjigal and Dharawal woman from La Perouse and a mum of 4. She has worked in health for 9 years and her current role is in the Aboriginal Women's Health Coordinator in the South Eastern Sydney Local Health District Women's Health Program. Sharon's role focuses on support and connecting Aboriginal women to access culturally appropriate health services, including health checks, such as breast screening. Sharon strives to be part of a positive change for highlighting and improving Aboriginal health. She is motivated by her own cultural knowledge and experiences to cater services to Aboriginal women living in Cessland. Then we have Clementine Bowles, who is a proud Wiradjuri woman from Wangal River region, currently living and working in Dharawal and Gadigal Country. She is the Community Chronic Health Engagement Officer from Illawarra Aboriginal Medical Services, with her work centring on Indigenous health promotion and education. Her role splits in 2, with one half focusing on consumer-guided health case management, advocacy and education, and the other half focusing on program development and implementation within the clinical and community setting. Next, we have Tiara Stewart, who's a proud woman from the Yuin country. She is in the Cancer Care Coordinator and is currently an Aboriginal Health Practitioner trainee at Women's Health and Wellbeing Corporation on the South Coast. Tiara has been employed with Wominda for the past 16 months. Then we have Christika Kuma Williams, who is a proud Wadi woman from the Wreck Bay community. Her grandfather is a Wiradjuri man from Carrara. Christika is a senior registered Aboriginal health practitioner in Australian bushflower practitioner with Women's Health and Wellbeing Corporation on the South Coast. Christika has been at Wominda for almost 13 years. And it's now my pleasure to hand over to Sharon Brown as the first presenter of today's webinar.
Thanks, Faith. Thanks, Denise and the BreastScreen team for allowing me to be part of the presentation. Denise, I'll just let you know when to go to the next slide. So thanks for the introduction, Faith. So I would also like to pay my respects, and as a proud Dharawal and Bidjigal woman from Lapa, or Laparoos, I would like to acknowledge all the lands on which we all work, travel and live on. I'm currently joining in from Gadigal land of the Eora Nation, and I pay my respects to our elders, both past, present, and extend all that respect to the Aboriginal people that are joining us today, and also to our non-Aboriginal colleagues. Next slide, please, Denise. So I work as part of the CES-led Women's Health team. So we are a small team. We have a program manager, 2 women's health nurses, and myself as the Aboriginal Women's Health Coordinator. We are also part of a bigger team at the Equity and Prevention Service. So our team caters services to priority population group of women. So that's across CES-led. For women who can't afford or need assistance accessing just specific women's health services. So focusing on that in trauma-informed care, and when yarning about women's business, it can also be a referral pathway to other women's health services. So that might be in a hospital setting as well. Our women's health nurses provide women's health checks at 5 locations across the district. And 2 of those clinics are specifically for Aboriginal women. So there's one at Laparoos. Our women can book appointments in to yarn about any health concerns they may have, including cervical screening and also information about breast screening. Next slide, please, Denise. So working in health, I have learned a lot from a lot of great role models and leaders, whether that be in community or working in health. After 8 years of working at the CES-led Public Health Unit, I started my new role as the Aboriginal Women's Health Coordinator in March of this year. My role is important to help identify and advocate and also highlight the priority health needs for Aboriginal and Torres Strait Islander women in our LHD. So that is cancer preventative screening as well. I have begun networking and building working relationships and partnering with health services that can be tailored or catered for Aboriginal women. I focus on connecting Aboriginal women with the health services, including our women's health clinics. A priority for me has been working on preventative cancer screening programs such as breast and cervical screening. I value my working relationships and work alongside the CES-led Aboriginal Health Promotion team at the Equity and Prevention Service and my Aboriginal Health Worker Network and the Directorate to get important health messages out to our mob. The next slide, I wanted to talk about the toolkit that when I first started working in this role. This is where, so I've been connected with the Cancer Institute and our team, Cancer Institute New South Wales, and our team often uses the resources for any events that we provide to women. The toolkit has been created specifically for Aboriginal people about the preventative and health benefits of important cancer screening programs, including breast screening. We use the toolkit to order or download resources and share awareness about important health information for our mob. Oftentimes, this is the best way to start that initial conversation. So when I've been at events and we're sharing information on breast screening, that's one way to introduce that awareness about an important health check for them, and also for their family members. The toolkit also contains other information that is great for Aboriginal people about other health screenings. So there could be screening programs for men, or even about the support services for if they have any risk factors or other health information that they might need. There is a section on breast screening, and I find having the most current resources or posters in your health service, or even what we do in our work, will help provide that awareness about breast screening for our women. So my next slide's about the rates for CES-led. So before I started working in the role, I was made aware that participation rates for our local health district and across New South Wales were low for Aboriginal women. And knowing how important this health check is for women, I made it a priority to work with my team and the Aboriginal Health Network alongside breast screen to try and increase the rates of participation for our women. It is particularly important to support Aboriginal women to have their breast screening. As we know, there is higher rates of incidence of breast cancer and can be at younger ages. Some of the outcomes of treatment for breast cancer can be managed better with regular breast screening every 2 years. Breast screening age has also been lowered to the age of 40, which is a focus of mine being in this role. So I am trying to encourage this cohort of Aboriginal women to participate in their first breast screening and supporting them through that journey. And statistics are showing, so you'll see there's a graph there at the bottom. It's fluctuating all over the place, but I'm hoping that there's a continued improvement in those rates. Supporting Aboriginal women. So we want to support Aboriginal women to access and attend breast screening. It is an important role for all of us, whether you're an Aboriginal person or not. So whether you work in Aboriginal health or you work in the mainstream, this is a role for everybody. The best way that a health service can support Aboriginal women to attend their mobile breast screen van or clinic would be to link in with local Aboriginal health or community service or Aboriginal leaders as well. We have that existing relationship with Aboriginal women built on trust and rapport. We can advocate and share the important health messages about breast screening for our women. Each community and service is different, and tailoring the delivery of the breast screening services for a group of Aboriginal women is important. Long before I came into this role, and before this role was developed, there have been strong Aboriginal women in my community and across the district that have been leaders and especially our elders who have worked alongside BreastScreen in the past and other partners to provide breast screening days for Aboriginal women within CESLID. And the BreastScreen team for CESLID are doing a great job at building those connections and listening to our cultural advice to tailor the breast screening services. So working together. So we've got a lovely photo of one of our breast screening events that we had in August. So it's been a positive experience for me to work alongside a big organisation like BreastScreen. Their dedication to networking and partnering with our team has allowed flexibility of making the service feel culturally supported. The partnership forming between our women's health team and BreastScreen is already showing positive outcomes for our women, that more women are coming forward wanting to know about breast screening and wanting to book in. Denise and the team from BreastScreen have allowed our services to allocate specific breast screening days for our women within our district. And this means blocking out particular days for the breast screen van and for Aboriginal women to book into appointment, as I was notified there was times when they couldn't book in for a specific appointment. And they have considered our cultural advice around the accessibility challenges and to best cater to the women attending the breast screening. The campaign in June also helped with increasing awareness. So I know that there was other Aboriginal health workers that don't work directly in the women's health team, but they were also aware about this information to share with their clients. And as Aboriginal health staff, we often draw on our own experiences to help relate or encourage our mob to access health services. That's why it's important to link in. And I've also a strong advocate for leading by example and having that common ground to support women, and also acknowledging all the great work that other Aboriginal health staff and leaders have done, whether it be in the past or currently. Their experiences are invaluable too. So the current events that we've done so far, so I'm only new to the team and just planning of it all, takes a little while, but we have done 2 events. There was one that was specifically for a group of women and it was an all-day event. And then there was another event that was connected to a service for Aboriginal women and also clients to a health service, but just the appointment-based, and BreastScreen supported both of those days. I'm also trying to focus on connecting Aboriginal women who are not directly connected to a health service or part of a community group. And so that means sometimes reaching out to other community services who have those connections and linking them in with BreastScreen. And knowing the impact of breast cancer on our women, not only my family, but also in our communities, motivates me to be a huge part of that preventative initiative to keep our women healthy and strong. So far, as I said, we've worked on 2 breast screening days, and then we have 5 events planned in the next month in November, so we will be busy. And there's there's 2 days for Aboriginal women for the mobile van at Matraville. At all the events, we were supported by BreastScreen with light refreshments and some incentive to walk away so that they feel they've had a positive experience. And we were also there to support them when they attended their appointment, just to make them feel comfortable before they walked into the van. The finding and considerations that I would, it's just sort of like some takeaway home messages that I have, and just understanding those common, the challenges for accessing breast screening and why there would be low participation, and then trying, I guess that's where our work has come together, trying to, find a solution and how to help women access breast screening. And cultural awareness and understanding is a very important part of that. Also, just a takeaway note for me is trying to understand how I can support women if they do have to go back for a second assessment, and how they would feel culturally supported or information. And that was the number one thing that I took away from a lot of the times we have a yarn with women at events about breast screening. And especially if then the younger cohort where they've never had a breast screening before, they're 40 to 50 years old, and they want to know more about it. So just explaining that. At one of the events that we did do, we had the radiographer there, and she explained the process of breast screening and then what might happen afterwards. So that was really valuable information to share. And I guess, I just wanted to reiterate, that's the end of my presentation, but I just wanted to reiterate how important it is to have those connections between the services and working together to make our women feel supported with this. So thank you.
Thank you. We now have Clementine Bowles.
Hi, everyone. Thank you so much for joining us today. It's such a privilege for me to be able to speak with you all, and it seems like such a great opportunity. So what I would really like to talk about today is just to explain the experience that we had as an AMS hosting a breast screen van visit for the first time, with the aim of building a relationship not only between the Illawarra AMS and BreastScreen New South Wales, but between BreastScreen New South Wales and the women and communities we support. So I've titled this little presentation, Building Habits and Programs in the Aboriginal Community Setting. And we're going to start off by having a little bit of a chat about our van visit, which was super exciting. So we've just come off our very first van visit and our first major engagement with BreastScreen New South Wales. It ran from the 7th to the 11th of October, which was a very troubled week with both a public holiday and our NAIDOC celebration in the middle of it. This meant that we were only able to facilitate bookings for 3 of those days. But despite that, we had strong community support and engagement with the service. We had a total of 30 women screened across 3 days, 14 of which were women being screened for the first time. And we were absolutely thrilled and privileged by this result and felt so lucky to be able to offer this service on site. The aim of this first van visit, due to its small scale, was to play around with approaches and figure out what worked well and what held us back, as well as to establish some key principles we can rely on going forward, which I'll have a chat about now. Whoopsie-daisies. So at the very beginning of this project, it became very clear that BreastScreen New South Wales wanted their work with us to be led by the AMS, and that gave me the fantastic opportunity to figure out how I wanted to go about it. Very early on, I wanted to ensure that I was guided by clear principles that would align with both the values of the AMS and the needs of our community, 3 of which I've set out here. First off, we have sustainability. I wanted to build a program that not only affected change while it was running, but also gave individuals the resources that they need to access services even without organisational support. When building programs, I never want the accessibility I'm aiming for to be at the cost of consumer agency. And therefore, we as a service needed to ensure that consumers were able to access healthcare with or without our support. Another aspect of this principle means engaging with the reality that programs, especially community-based programs, come and go. And in order to make a lasting change, we had to place an emphasis on creating something that can be integrated into everyday life and carried on by individuals. Secondly, we have a strong principle of co-design between the AMS and the community that we are serving. I wanted to create a program in partnership with the community and offer an open-ended and non-prescriptive approach that ensured the greatest availability of services to the community. This principle is especially important when it comes to working with Aboriginal and Torres Strait Islander communities. Self-determination and agency must be centred at every step of the process. The principle of co-design is actually especially important not just in its own sake, but specifically for my benefit. I felt that it was vital that I acknowledge early on that not only am I a representative of an organisation in this instance, but I am also a young woman. I have never had a mammogram, and if all goes to plan, I won't have a mammogram for another 17 years. I am at a very different life stage to the women we are attempting to target, and by employing principles of co-design into this project, I was able to defer to their expertise on their own lives and go in with a sense of curiosity rather than assumption. The last principle is probably the most boring, but also the most vital. In the rollout of this program, I wanted to make sure that we were going to take full advantage of the existing infrastructure of both the AMS, BreastScreen New South Wales, and the local health district, which is ISLID. I wanted a routine of breast screening to slot neatly into the regular practice of our clinic and engage with the existing relationships and resources already available to our community. I'll talk a bit more about how I worked on that a bit later. For now, we're going to continue to see how these principles affected the program itself. We'll be going through these in order as I really want to make clear the impact that these design principles had not only on the van visit, but on the work we'll be doing in this context in the future. First, we'll have a look at sustainability, this principle focusing on giving consumers the resources to access screening even in the absence of a breast screen van visit. This ensures the agency of consumers to dictate the service of their health, while also ensuring that when they are ready, they understand where those services are, how they work, and how to access them. We did this by integrating breast screening education into our 715 health check for eligible women, including questions about their accessibility needs, if they would like extra support, as well as offering an appointment during the van visit. This way, consumers could be booked in to have their mammogram while in the doctor's office, limiting the amount of labour that has to be done by the individual and instead placing that burden on the AMS. We also held breast screen education days during our weekly Sister Girls Women's group. For one of these, we even had Denise come down to present, which was an absolute pleasure. During these days, women were encouraged to bring along the other women in their families, as well as take resources home to them and disseminate information throughout their communities. This education was focused not only on eligibility, procedure, and assessment, but encouraged the older women to discuss their own experiences, to describe what it felt like, what the room looked like, whether or not they felt comfortable with their radiographer. By talking about these experiences, every woman involved is better able to advocate for themselves, as well as having a better understanding of how the process works and what is likely to happen. So with this second principle, we're back to co-design. In order to properly employ this idea, community became involved at the very beginning of the development process. This mostly involved speaking with consumers, both within the community groups and as individual clients, about what they would like to see during the van visit. It was important to consider that this was time taken out of their week, time when they would have to organise childcare, elder care, take time off work, time that could be spent doing a myriad of other things. To take proper advantage of that time, other health services were offered in conjunction with van appointments, and these were mostly dictated by the women themselves. Some requested health checks, others asked for mental health care plans, immunisations, etc. By offering a two birds for one stone approach, we were able to respect the time and commitment of our consumers. The community also made us aware of the pre-screening anxiety that needed to be overcome in order to participate. This included the anxiety of a first screening, as well as the anxiety of a prior bad experience, and the worry about how the results will come back. In an effort to mediate this, we offered a session on the second day for those consumers who had self-identified as particularly reticent. This included sitting outside for a period and going through culturally informed breathwork, facilitated by our fantastic Koori breathwork instructor, Cindy. This gave the women the opportunity to sit near the van and work through their anxiety rather than pushing themselves through it in order to access screening. For me, it was probably the best bit of the whole van visit. It was such a lovely moment to just sit in the sun and breathe with these women. With this last principle, it had a big impact on the mechanics of the program. The AMS functions primarily as a primary healthcare clinic, where the community is able to access the services they need outside of a mainstream setting, and with cultural values embedded within the environment. There is tremendous value to that existing setting. By integrating breast screening into the everyday running of the clinic, it gave us the capacity to offer new services as an extension of the AMS, rather than as something tacked on the end. I worked with existing clients to extend their level of care to breast screening, offering it on-site, surrounded by familiar faces, referred by their regular GP, and in a car park they've been in before. The AMS exists as a community entity, and thus we're able to facilitate a healthy relationship between our clients and a mainstream service, and that in turn improves the level of care we're able to offer. Lastly, I want to talk a little bit about our goals for the future and how we'll be developing on what we've learned throughout this process. Obviously, an important factor will be not organising our van visit on a week with a public holiday, but that aside, first, we would like to be able to organise ongoing group visits to BreastScreen New South Wales. This will help to ensure sustainability by getting consumers familiar with that clinic and giving them an insight into the space if they're ever called back for assessment. Secondly, we would like to run our breast screening program in conjunction with other cancer screenings, such as cervical cancer and bowel cancer screening. The goal of these programs is to increase awareness of these screenings and create habits that can last years and influence the greater community. Another important goal would be to organise the van visit into a regular yearly occurrence, something our women will be able to rely on, happening at the same time of year in the same car park and organised the same way. This too will help to decrease the amount of labour done by the consumer while still equipping them with the capacity to do that labour all on their own. We would also like to see BreastScreen's involvement in our NAIDOC Day celebration, with screenings offered on the day as well as the capacity to book in. And finally, and perhaps most importantly, I would like to continue with this project in such a way that as much organisational power as possible is redistributed to the women being screened. Regardless of the institutional investment with this project and my own work, it is their bodies, their time, their discomfort and worry, and their needs that should be listened to. And not only listened to, but that power should be relocated away from organisations and towards the consumer to ensure they have the utmost control of their own experience. So I'll leave you all with that, and thank you so much for listening. I have no idea whether I've gone above time or below time, but I'm so grateful that I got to engage with such a valuable program, and a special thanks to Denise and Faith, who have supported me so consistently since the beginning.
Well, thank you so much, Clementine and Sharon. Your presentations have been wonderful so far. So next up we have Tiara Stewart.
Good afternoon, everyone. So today there's going to be two speakers from Wominda, so we might start off with an introduction. So my name is Tiara Stewart, and I am a proud woman from the Gweagal Country. I am the Cancer Care Coordinator, and I am currently an AHP trainee at Wominda's Women's Health and Wellbeing Corporation on the South Coast. I have currently been employed with Wominda for the past 16 months.
And hey everyone, my name is Christika Kumar Williams. I'm a proud Wadi Wadi woman from the Wreck Bay community, and my grandfather is a Wiradjuri man from Cowra. I'm a senior registered Aboriginal health practitioner and an Australian bushflower practitioner with Wominda's Women's Health and Wellbeing Corporation. I've been at Wominda for almost 13 years now. And following that, I'd just like to do a quick acknowledgement. I'd like to take this time to acknowledge the country we work, live, and come from, the Gadigal Wangandian country. I would also like to pay my respects to the elders of yesterday, the elders of today, and the elders of tomorrow. I would like to also extend and pay my respects to all the aunties, uncles, sisters, and brothers online, and give thanks to the ancestors who have paved the way for us. Waminda pays respects to our ancestors who have walked this country since the creation of time, as they have paved the way for us to be standing where we are today. Today, we'll be sharing with you a presentation of our unique organisation, Waminda, and we'll be yarning around the role of how we support our Aboriginal women in community with their cancer care screenings and journeys.
So the next slide is a bit about Waminda's vision. So we are a safe and holistic service providing women and their Aboriginal families an opportunity to belong and receive quality health and wellbeing support. Our key focus is to provide tailored strength-based care. So the next slide is Waminda's model of care. So our model of care is founded on our Aboriginal ways of knowing, being and doing. We pride our service on being a decolonised service and pushing back on structures and strategies that are not safe for our communities. So we take up the fight that began by our ancestors and calling out racism and discrimination that have affected our communities and well-being. So culture will always be the foundation of Waminda's model of care, with Aboriginal women and their families always being at the forefront of receiving holistic wraparound care, where we walk alongside our women and their families' journeys. Waminda's model of care is guided by three key frameworks: our culture, Balang healing, and staff wellbeing frameworks. These frameworks are based on our commitment to self-determination, decolonisation, and ensuring our staff are supported and culturally safe. When looking at the centre of the model of care, you will see all the coloured circles, which represent our clusters, with all Waminda's programs embedded in them.
Yeah, so with the model of care, this will require another whole presentation to talk about. So we'll move on to our next slide, which is our Minga Bunan Gunya. This is our clinical building in Nowra. So Minga Bunan Gunya is our main primary healthcare site. However, we have numerous outreach sites: Direct Bay, Jerinja, Ulladulla, Kumadichi, Wollongong, and Wallagalek. We also outreach to our Aboriginal aged care facility, Rose Mumbala, in North Nowra, and our Aboriginal Child and Family Centre here in Nowra, called Kulanguddy. So our Minga building has up to 7 clinical rooms, a treatment room, an intake room, a clinical hub, reception, and admin for the whole of the service. Within this building, we have our registered Aboriginal health practitioners and Aboriginal health workers, midwives, our nurses, our GPs, and allied health and specialists such as our physiotherapist, dietitian, exercise physiologist, diabetes educator, naturopath, massage therapist, geriatrician, endocrinologist, general surgeon, ophthalmologist, podiatrist, and audiologist. So our primary purpose is to provide a holistic strength-based approach that amplifies lifestyle medicine strategies and is preventative focused. So our Aboriginal health practitioner team. So that's on our next slide. So Waminda has 10 registered Aboriginal health practitioners and with 6 in training. We are strong Aboriginal women working across the service who are at the forefront of our primary health care and wellbeing programs, whom these women lead the space for our clinicians in prioritising prevention, lifestyle medicine, and holistic care. The Aboriginal health practitioner role is critical and pivotal in how we operate at Waminda. We are not a GP-led practice. We are an Aboriginal health practitioner-led practice and centre a social model of health and not a mainstream medical model. What I mean by that is a holistic social model of health is. Our primary lens is Aboriginal ways of knowing, being and doing. And that means caring for the whole person in relation to their social, emotional, physical, spiritual and cultural well-being instead of looking at a person as a set of conditions. Our Aboriginal health practitioners are the heart of this model. And for us, it is a privilege and honour to work alongside our community women and their families. Furthermore, we're saying all of this from the needs and wants of our communities, and especially our young boys and young men. We have our first male Aboriginal health practitioner in training who will support all our youth male programs, men's business, and support our men at outreach clinics. Waminda predominantly is a women's health and wellbeing service. However, we have just opened up 2 men's outreach clinics to support the needs that come from our community and supporting the whole family.
So in this slide, we're going to touch a bit on our partnerships with the BreastScreen and McGrath Foundation. So Waminda is very lucky to have an ongoing partnership with BreastScreen, where we are honoured to hold their BreastScreen van twice a year. So recently in September, we had the BreastScreen van come out and they were here for 2 weeks. And before that, they came out in April and they were here for 1 week. So Denise from BreastScreen also attends our health and wellbeing Pamper Days. We have a breast cancer genetic counsellor, Jess from New South Wales Health, who attends our wellbeing and Pamper Days and supports with our community needs. So with working with the BreastScreen van, so they have came to Waminda a couple of times now, and we have had 4 to 5 clients diagnosed with breast cancer.
Last 2 visits, yeah.
So in the last visit, so just recently in September, we had an auntie who has currently been diagnosed with breast cancer. And before that, in April, we also had another auntie who, just came to Waminda to have a cup of tea, and the BreastScreen van was at the back in the car park, and we was like, hey, do you want to go and have a mammogram done? And she was, sure, why not? And then from there on, she was also diagnosed with breast cancer. And so with our clients, we follow and support them with their cancer journeys. And then we also have a partnership with McGrath Foundation. So Waminda is also honoured to have a really great partnership with the McGrath Foundation, which supports our cancer care program. It provides education, provides our AHPs with cancer care knowledge around service delivery, management, treatment, and patient-centred care. Within this partnership, we have our AHPs, nurses, trained to then support at our local cancer care hospital. This is an incredible partnership because it is creating continuity of care for our community who get screened in our service, then are getting treatment by another service. So in the next slide,
yeah, so in the next slide, we talk about our comprehensive care and end-of-life programs, which we support our women that come through our clinics and that access our community programs at Waminda with. So Waminda has the privilege to provide culturally safe, it supports our Aboriginal women and their families that are going through their cancer journeys and entering the dream time. So these programs are called the Comprehensive Care Program and our Palliative Care Program, so end of life, which are unique programs we have implemented within our Waminda's model of care to support our women and their families that are going through their cancer journeys. So that's for our women that have had abnormal screenings, cancer diagnosis, and that are receiving treatment or not treatment, and that are entering obviously the dream time, and how we can support them with that journey. So this program is made up of supporting women to access special appointments. So that may be coordination in booking the appointments, following up with abnormal screening, getting them back into our clinic, being able to support them during their doctor's appointments, and breaking down that health jargon that might go over someone's head. It's very hard to hear that sort of news and take that in for a lot of people. Some women don't have families as well, so we can be that second ear for them, to be there to support them from start to finish with their journeys. So the coordination may include, following up with that abnormal screens, as I said, booking the appointments in, going to the specialist with them, and then coordinating any medical aids or any treatment plans that they have as well, and just following through with all that. Also, so building a partnership with the McGrath Foundation, where our Aboriginal health practitioners and nurses can support and provide care to the women throughout our local cancer hospital. So building a partnership with the Breast Screening of New South Wales is to provide access for our women, for all communities, to get their mammograms completed in a culturally safe space that involves transport to the programs as well, and for them accessing our breast screening van as well. And we can support them up at the Cancer Centre as well. So the partnership with the McGrath Foundation and the link with the Shoalhaven Cancer Care Centre, they've actually supported our Aboriginal health practitioners and practitioner trainees and nurses to be able to do some training within the Cancer Centre. So what that is, so we go up to the Cancer Centre and we do different sections within each of their treatment services. So up with radiation, chemotherapy, and in the actual clinics as well. So we're able to see what the service provides and how we can support our women and break down those barriers and the fears, and be able to educate our women that will be going through that journey as well. So during that, we're facilitating culturally safe and nurtured yarns with our women and their families around their wishes, and putting things in place to support their family for when they enter the dream time as well. This can include things as advanced care directives, wills, legal support, organising their funeral arrangements, helping them with the wakes, and setting up grief and loss supports as well, counselling, psychology, just to be able to support the family and wrap around comprehensive approach as well. So the next slide I might touch on. So this is our health and wellbeing pamper days. So Womenda's been providing these health and wellbeing pamper days for many years now. So these pamper days, so we do 2 of them in 6 different locations in our Aboriginal communities twice a year. So the areas are from Wollongong down to the Ulladulla areas. The health and wellbeing pamper days are about bringing Aboriginal women together in a safe environment through health checks with our Aboriginal health practitioners and nurses, access to immunisations and vaccinations, information on all Womenda programs, Womenda's health education, yarn ups and screening. We provide Australian bushflower remedies on the day. We stop to have a guided meditation and breathwork session. We have cultural arts and crafts set up as well. So that's weaving, dot arts. This is where our women gather and can have a yarn and, do these activities. And it's a really nice, calming, beautiful time to sit there and yarn. And these women are given the opportunity to be pampered by the beauticians. So the beauticians provide services such as waxing, haircuts, and massages. And this is an incentive for our women who come to these days to prioritise their health, and also walk out feeling really deadly at the end of the day as well, feeling really confident and good about themselves. And they love it, and our women just love it. And that's a soft entry into our service as well, and an opportunity for us to, answer questions and be there to, give information on what we can provide for our women. And it's really great having our services out there like BreastScreen, and Denise has been really amazing. She comes out and it's a good chance for our community to meet our women that we partner with, and we can book them in for screenings and that on the day, which has been really successful and really amazing. So we're very, very grateful for that. And we've also had our breast screening genetic counsellor, so Jess from New South Wales Health, and she attends the Health and Wellbeing Pamper Days as well. And that's been great to give information back to our community and, do a bit of a community consultation and see what the needs are and link in from that point on, which can be really hard for some communities as well, where they don't really come out of their communities and sort of get, there's different barriers to access health needs. So having them come out to community has been very vital and amazing for us and our women. And the next slide, please. Yep, so we'll touch a little bit on the Australian Bushflower Essence. So we've established a unique program within Waminda by having 2 Australian Bushflower Essence practitioners within the organisation. So providing Aboriginal women and their families access to Australian native plant remedies. So a little bit about the remedies. So Australian Bushflower Essence is a natural alternative remedy that are made up of 69 different traditional bush flowers from Australia. Each flower has a traditional natural property, or many properties really, to help a client heal through social, emotional, physical, and spiritual health. So these essences are completely natural and don't contraindicate with any medications or any medical conditions. And these remedies are safe for babies, children, adults, so from 0 up, and even women birthing their babies as well. So these essence brings our women back to Australian Aboriginal ways of knowing, being, and doing through our traditional practices and medicines. And so these clinics have been really popular for our women that access these and take these essences, and they really have amazing results from using these as well, and have amazing outcomes. So yeah, I think that's us now. Thank you so much for giving this opportunity. We're really grateful for our connections and our partnerships with BreastScreen. It's been amazing for our women to provide that wraparound approach. We thank you.
Thank you.
Thank you so much, Sharon, Clementine, Tiara and Christika, for your wonderful presentations. It really gives us an insight into the work that has been going on in this space and makes me very hopeful for the great work to come, not only on our mobile van, but also at our clinics. There was no questions posted in the chat, but if you do have any, please put them up and we will get back to you with any responses. So just finishing up, I'd like to thank you everybody for coming. We've also got the link in the chat for you to that Denise is putting up now. It's a survey for our presentation, so I appreciate it if you took the time to go in and fill that out. So thank you everyone for coming. It's been really great to have such a range of staff attend. The webinars have been an excellent way to encourage health professionals who are referring their clients to BreastScreen. The recordings are available for any staff who were unable to attend, and also for staff from the partner organisations Waminda and Illawarra Aboriginal Medical Service. Please complete the survey again if you have time. This webinar officially brings our Breast Cancer Awareness Month webinar series to an end. The presentations today show some of the ways in which we can support Aboriginal women and communities to attend our services for their routine breast screen. If any staff online would like to reach out to our health promotion team, and the email is being put in the chat. So some of the things we're able to offer include special screening days for communities, group bookings on the mobile vans and at our clinics. Our staff can attend your Women's Health Days and community events. If you'd like to work with us to increase screening for your community, please do reach out to our health promotion team. Launching off from the hard work which the presenters have talked about today, I would just like to commend the presenters for the connections they have made with BreastScreen service and staff, and I'm really looking forward to further collaborative work and working together. So thank you, everyone.